somatic and trauma therapists are usually trained to catch these things. They become really keen observers, but of course they're human too, and they could miss it. So that's why there's always a dialogue in trauma work of what are you noticing right now? What are you noticing in your body right now? But yes, we are trained to, like for brain spotting, I'm constantly watching your eyes. I'm constantly seeing when your eyes are going, you know. Are your eyes getting really big? Are they having the $1 million stare? Are they stuck on a spot? Are they skipping over something, right? And so with that model, it's bringing conscious awareness to what was otherwise probably dissociative for you. And once that conscious awareness comes in, that's a little bit of titration, by the way. You're like, oh yeah, I guess I am. Wow, yeah, I'm. No, and then I'll say, no, it's okay. Stay there. Now we're gonna do some bilateral, either tapping, bilateral sounds, bilateral tappers, so that we help that brain groove that's been overused, whether it's a dissociative groove, a freeze response, or a fight groove, flight, fawn. And we want to use the other neural networks. So that groove uses a different path. So I want you to keep looking at that spot, for example, and then the bilateral stimulation is going to help the brain start to use these other neural networks so that, oh, okay, I'm feeling myself breathing more. Okay, notice yourself breathing more. You're doing great. Okay, yeah. Oh, I just had a memory, right? And then, because now other neural networks are working, and then I might say, okay, now come back over here. This is your resource spot. Remember when you were looking over here earlier? This is when you were talking about how you love gardening. I want you to look back over here. Oh yeah, oh God, I feel so much better looking over here. Okay, great. So look over there. Then when you're ready, we're gonna look back over here. So that's one example, right? And that would be a way to practice titration with something that's otherwise activating. And that's a way that a therapist catches when a client might be getting dissociative, is through the eyes. There's other body cues too. I mean, obviously someone literally looking like they're frozen and really tight, you know, is always a cue. Someone that's constantly moving and agitated is obviously another cue. Relational trauma, this is why therapeutic work is so vital for relationship trauma, because the client and the therapist reach a level of attunement together. When a client is starting to do things that are purposely or unconsciously misattuning, that's when, ooh, we got some juice here, right?
So give me an example of that.
Yeah, so that would be like, no, I don't agree with what you said. Oh, okay, tell me more. You know, good. No, I don't feel it. And looking away, you know, kind of having a little bit of attitude suddenly. It's like, oh, we got some good juice here, right? And then I would say, oh, are you noticing how you're feeling right now in your body? I'm feeling fine. Oh, okay. Do you feel the same as you did 5 minutes ago? Yeah, why do you ask me these questions? You know, it's like, are you noticing that you're feeling some different feelings towards me right now? Well, yeah, you annoy me sometimes. Okay, good. Tell me more about how I annoy you. And then usually there's a switch again, more like fear or nervousness. I can really tell you that I'm annoying you or you're annoying me. Like, well, yeah. And then they look a different direction, or so that's kind of it. Like, and just you have to like get on it, on top of it, right as it's happening, because there's a relational attunement and misattunement that is really describing one's attachment style. You know, what happened with their parent when they were a child, you know, and as an adult, we're always trying to repair our attachment. So if we were angry at our parent, but it wasn't safe for us to be angry at our parent, that's going to kind of start to come out in therapy. And we want the client to feel safe enough to express frustration. And yet, if they're only expressing frustration, that's another attachment style, right? So we just bring conscious awareness to these things relationally so that they're not, again, going down that same groove, that same nervous system response, that same brain response, so that they recognize, oh, wait, I have other ways I can respond to this right now. I don't have to go back to the same way I always respond. I have other choices.